today, for our Expeditions project, for our research spotlight, we are excited to talk to our collaborator, Anuj Mubayi. And you have just started at a new company, I know. So tell me all the different groups that you're affiliated with.
Thank you, Erin, for having me and discussing on various things of my background research. And currently, I'm working for a public health company. It's leading a group on infectious disease forecasting. And we have lots of plans in actions right now, and we'll see how we do it. But I'm affiliated with Health Economics Institution in India. It's called as Kalam Institute of Health Technology. I'm a distinguished fellow at there. Also, I'm part of Illinois State University Center for Collaborative Studies. It's in mathematical biology area where I'm a distinguished fellow in this center as well. I'm adjunct faculty at Department of Mathematics and Computer Science at Sri Satsai Institute of Higher Learning, is also in India. And these are simultaneously affiliations. So I'm doing
Right.
some different types of research work, collaborations with them, outreach activities, and hopefully I'll get a chance to discuss of those ones with you.
Yes, definitely. And then it sounds like you don't have any free time.
Well, free time is a research time.
Yes, right. I know. Yes, as we're all still living at work these
Yeah.
days, for sure. So, with your new position with the public health company, I know that COVID has really brought to the forefront the need for public health analytics, public health work. So, I'm guessing that you're not only working on COVID with that company, because there are a lot of public health issues that need to be addressed.
Precisely. I mean, there are lots of issues that we have. I mean, pandemic has highlighted vulnerability in the healthcare system
Yeah.
and highlighted gaps. And we are realizing it to that. And it is opening up a can of worms where the challenges that we face on a
Yeah.
day-to-day activities in handling a large scale problems, healthcare problems in general. So we are looking on those end in a general setting, in a much more broader setting in public health, rather than just looking at the COVID. But definitely the pandemic has guided us to see in that direction. But from my background, actually, I'm an applied mathematician by training. So I use mathematical models I built and kind of link it to the real life and translate the results into community level understanding for interventions for various things. So that is the work that I am part of in the public health company that I'm currently part of. But with my collaborators, I'm doing things in health economics, for example. So, a lot of time we build infectious disease models and we project and trends and intervention in. But how many cases will occur in few weeks' time has less importance if you do not talk about cost of controlling it attached to it.
Yes.
So
Yes.
the economic aspects and the disease burden should go hand in hand. And that is the field called as health economics, where we study the economic burden or value of some interventions for one person may not be the same value for the other person. And that's how do you evaluate that value? So those are the things that I also work on, for example.
Wow, that I just can't even imagine the challenges involved in that and all the different aspects that you have to consider when you are building those kinds of models. Very
Yeah,
challenging.
it is. And one of the challenges, of course, the data sets that we want as a modeler. Data sets are collected by empirical scientists. Those are not mathematical modelers.
Yes.
And models are usually developed by quantitative scientists. And, they are usually done not in relation to each other. Suppose if I am doing the experiment, I'm designing the experiments to parameterize that models versus I'm collecting a data on one hand and then linking it with the model that I had for some other purpose. So these are two different things to look at it. Now, actually, we are realizing that linking is a big issue with the
Sure.
modeling world. So that is one thing. And second thing is, so data itself is some places are not available or incomplete or less accurate.
Right.
And so there are those challenges associated with it. And we are realizing that we have to bring different systems together so that there is a smooth flow of informations, both in terms of data and modeling results and implications and decision making process. We are collaborating more than ever before with the different interdisciplinary teams, but the design of experiments have not been truly, when you design an experiment, there should be people from all disciplines who are involved in this projects, for example, to be deciding on what experiments to design. In the past, usually experimental scientists have been focusing on these aspects rather than modeler sitting there and helping them design also. Things are changing quite rapidly. People are realizing that thing. We need a different sets of data. We need adaptive data continuously coming to that rather than just one snapshot of the data.
Right.
So, yeah, and GPC, Computational Epidemiology Group, is amazing, is a forefront leaders, all the researchers in the group in this area. And they are some of the few scientists who are looking into these aspects of where are the gaps and how can we overcome those.
Right. Yeah. I was thinking as you were talking, you could be describing the GPCE project
Yeah.
with, I mean, all of that, right? The modelers are talking to the experimental scientists. Yes, it's a fabulous collaborative group for
Yeah.
sure. Your work obviously impacts people and day-to-day life, and you talked a little bit about communicating the science to people. I think that that is a big disconnect right now in our world, is between the layperson, which I count myself as the layperson, and the scientists. I have friends and family who ask me all the time, well, what do I believe? Should I believe this journal article and this scientist who says that, or this journal article and this scientist? So how do you envision that your work can impact that positively, or what things have you seen that are being done to sort of impact that scientific communication with the lay people?
Well, just to give you some example, I want to start with an example. When I was in my graduate program, there was no class where we were taught how to write a simple article in some magazine. For example, on LinkedIn, when
Right.
you write a long, short paragraph, you express yourself, and how do you express it? Or Twitter, for example. So I think we are learning many of these aspects by trial and error
Right.
rather than a formal training in our classroom. So I think this is also is a very big realization that not only science communication, but also looking at how do we talk to even technical folks, like
Right.
interdisciplinary technical folks. There's no classroom that teaches a formal way of how do you talk to a biologist. I'm a mathematician. How do I talk to a biologist, for example?
Right.
It is expected by default that I will learn, and whatever I will learn would be the best way.
Right.
Right?
Right.
So I think this is one realization of the fact that these are the gaps
Hmm.
that we need to fulfill. Mentoring, for example, some mentoring of new generation of scientists. There's no classroom. There's no formal way of. I was part of award-winning program. I was directing a program at Arizona State University. It was called Mathematical Theoretical Biology Institute. There we were focusing on this mentoring aspects. We have our PhD students graduating, and then all of a sudden they go in the job market, and we expect them to mentor undergraduates, graduates, and all to, have a large group of research scientists.
Right.
Well, they can do it, but they will do as a trial and error. But if there is a formal way of some of these things inbuilt, making it as a part of our curriculum in the graduate programs, that would really, really help. Also, another thing is we are realizing is we focus too much of research, and then we don't train them as a comprehensive scientist, and
Right.
that mentoring is one of these things. Science communication is another one, but also mental health. I wrote a
Oh.
paper on models for mental health for AC students, and we couldn't find the data on that. So we collected our data through a social survey that we carried out for AC students, for example. And it's a published paper, by the way. Those aspects are not taught. I mean, it is not expected for them to register for that course. I mean, there might be wellness programs in all
Right.
the institutions, but I doubt that there is any curriculum in mathematical science that forces students to take that 1 unit or 2 unit or 4 unit of courses every semester or few semester. And this is very complex things. I mean, I think if there is a healthy mind, they will do a wonderful research. And exposure like GPC, for example, provide a wide exposure. It's not only in one particular area of computational epidemiology. They are empirical scientists. They are health economics, for example. And there
Right.
are other area, computer scientists, mathematicians, you name it. And there is a list of researchers attached to it, which is what I find it amazing.
Right.
But how many GPC are there in the nations, right?
Right.
That's
Yeah.
the challenge. And I think this is really a true model for having it in all universities, and that students can see the wide spectrum of research, but at the same time also going through these additional aspects in the curriculum that will help them grow stronger mentally, health, physically, but at the same time write good in science communication to a layman's perspective.
Right.
How to put your research, I find it very, very important if you put your research on a regular basis on social media. But
Right.
the question is, how do you put it? Right? You can't just
Right.
put it as a link of it. It will have zero impact, literally.
Right.
But if you write few lines, and what do you write in that few lines is very, very key, actually. But the good thing is you don't pay for it, right? You just are free to write what you want there.
Right.
But if we can guide them a little bit, how do you write to, I mean, Twitter is very, you have to write very, very short, you have to write, right?
Yes. Yes.
And, and is still able to express your research paper, for example.
Right.
So those are the things we are realizing and now building it in the curriculum. I do a lot of outreach impact also. And that with Dr. Madhav Marathe, we wrote a paper, very good SIAM news article. I'm also a regular writer for SIAM news article, for example. So those things are helping me personally, and I have whatever the new generation of scientists are coming in link with me, I'm kind of guiding them on these aspects. And GPC is also doing the same thing, I know for sure.
Yeah, those things are so important because we do expect these young scientists to be mentors. But if they've never been properly mentored themselves, if they don't know what right mentoring looks like, it's really hard for them.
Mhm,
In
mhm.
addition to their research, which is also hard.
Well,
Um,
I want to add one thing.
yeah.
It's a human nature to be in our comfort zone. And I think things have changed quite drastically
Hmm.
uh, because of the pandemic. I mean, there are bad things that has happened pandemic, but there is good things also. It is kind
Yes.
of catching our attention,
Right.
which we would have not done otherwise. So I think we are building it, but the way we are building it is slower. We need to build it much faster in that.
Yeah, I agree. So we've talked a little bit about the non-research side of your work. How did you get here to the point that you are in your research? Where did you start and what brought you here as a mathematical modeler?
Well, I feel I'm very lucky actually. It happens to be like that, or maybe I took a decisions from time to time in such a way that I'm ending up in this current level. But when I say that I'm lucky, I'm trained as an applied mathematician. I got a postdoctoral experience as an infectious disease person. I was
Oh,
in an
okay.
infectious disease department at the Cleveland Clinic.
Okay.
I was also part of Center for Global Health at Case Western Reserve University. And then I also worked in health economics at Precision HOR, which is a private company actually, and work in health economics and outcome research, which is a separate field. It takes into account healthcare and the economics. It's at the intersection of health economics.
Right.
So what I have seen in my background is applied mathematics to some experience in infectious disease, to some experience in global health, and then health economics. And that has really made me think in a very different way than traditional applied mathematicians, for example.
Sure.
I've been part of field studies like survey design, data collection through surveys. I have been part of entomological studies where we have collected mosquitoes for diseases, and also community level where we want to collect data for some health metrics. and I work with South American collaborators, South Asian collaborators quite heavily, which are different environments. It's a developing countries with ecological conditions very different, and the disease
Yeah.
are spreads in a different. Sitting here in US, it's very difficult to model those things until unless you go and part of it and collaborate with them.
Right. And you put
So,
eyes on the area and you,
right.
yeah. Yeah.
Yeah. And this have really helped me grow to and see things in a much wider angle. And as a decision maker, suppose if we want to, my model result says one decision versus another. Sometimes you don't take an optimal decision always. It depends on how optimal it is. You can
Right.
even go for less optimal one if it is beneficial from a cultural and social factors. It is much better for that population. So I'm looking from that. And we recently wrote a paper for COVID, the gaps and also the how do you address that issues moving forward. And we talked about multi-resolution approach, which involves community in. I mean, we are talking about mathematical model. Where is this community coming into? We can't see
Right.
it as a quantitative scientist, but I think we are proposing in that paper is you need to have the involvement of it. Otherwise, you will come out with a best policy which may not be applicable or acceptable to the people at a local level. So
Right. Yeah, absolutely. So much to think about. What I really love in all the folks that I've spoken to with the podcast or with this series is seeing everyone saying the same thing. Do you know, and when I was speaking with some folks who organized one of the NSF PIP committees, they
hmm.
said the hardest thing is that, the sociologist and the epidemiologist, they don't speak the same language really, especially when it comes to publications and research. What the research that's important to the sociologist, not necessarily to the epidemiologist, but should be and would be if they understood better what they were trying to accomplish. Yeah.
You made a very good point about, we are not talking the same language, same. I
Yeah.
just give you an example. When we talk about model, word model, from a mathematician perspective, it is an equations. When model word is used by biologist, it is the rat, mouse.
Yes.
And when you talk to a social scientist, it is a flow chart. Model is a
Right.
flow chart. When you talk to the engineer, it is a design of a real life. This
Right. Yeah.
small.
Yeah.
So the same word across the disciplines understand and interpreted in a very different way.
Right.
When, for example, there's a word we use like risk analysis. The risk for different people means very different. And even though when we were mentioning about science communication, when we write these words for a general public, it is interpreted, could be interpreted, if you are not very careful, could be interpreted in a very very different way. And that's, for example, social scientists takes lots of time in designing their questions for social surveys. And that was very hard job, because I tried to do social survey at Arizona State University. I wrote my question and I gave it in my class as an example. So let's see what is the response. And it seems like they all 30 students understood in a very very different way, and they
Oh
answered
no.
it in a very different way. So just to be consistent in the words that you express
Mhm.
for answering the social surveys, for examples, there's a skill set involved.
Yes.
And this terminology is very major issue. I just wanted to point out these
Yeah.
things.
Now, what I'd really like to know, so you've talked a little bit about all the different places that you've been with your research and the things that you've done. So, what is one of your most interesting or memorable or weird or, oh my goodness, I can't believe I'm standing on the edge of this volcano or whatever it is kind of moments? Can you think of one that really stands out for you?
Well, there are many, but I think two I love most was Banff, Canada. And the second one I would say is Leticia, Colombia. So these are the two amazing places. Banff is more in the Rocky Mountains, and like
Right.
a lot of snow. And there is a Banff International Research Station, which also have a mathematical workshop on a very regular basis. I organized a workshop there on substance abuse and
Oh,
mathematical models like drug addiction, alcohol addictions of different sort. And we had almost 50% as empirical scientists, social scientists, prevention research scientists coming on board, and some are computer scientists, mathematicians, physicists. So amazing workshop that we carried out there, very successful. And so that place is amazing to do any research, and probably that is the reason why this mathematical research station is there. um, I don't know if you have heard of BIRS, it is called. It's a very famous mathematical research station. And the second place that I was talking to you about is Leticia, which is a Colombian city in Amazon jungles,
wow.
basically.
Yeah.
We were there to do some research on neglected tropical diseases. Like there are lots of insect diseases like Chagas disease and many other diseases that are very common there. And I was there to be part of the mathematical modeling team. It was an amazing experience as both the places, one is very in wilderness, the other one is very also wilderness but in a different type actually.
Right.
So one is tropical, one is very cold. So
Right. Yeah, very different.
yeah.
Yeah, that's so awesome. The opportunities that come when you're not afraid to say yes,
Yep,
right?
that is very true. That is very,
Yeah.
very, you made a very good point. The problems, WHO has certain number of diseases that they call it as a threat, global
Right.
health threat for next 10 years, for examples.
Right.
And those problems are real life threats and they are not discipline dependent. Okay.
Right.
So then when you are trained in one discipline, you should be adaptable to learning new things in different areas, but also adaptable to the regions. And literally, you have to think from the angle of local people. Then
Yes.
only you would be able to get a good quantitative models or any kind of analysis that you are doing right and more appropriate.
Which is a fantastic segue to our final question. So, thinking back on your career and you have a student and they say, I want to do all the things that you did. How do you do that? So, what advice would you give to a student who is interested in mathematical biology, mathematical modeling, or health economics, or any of these fields?
Well, it's very difficult to do all at the same time. But I mean, everyone's life trajectory is very different than the other
Mhm.
person's life trajectory. I think what is the major advice that I could give to the student is find out the passion in yourself. For example, when students come to work with me, I don't give things from my own research, oh, do this problem and you will be wonderful there. I, in fact, talk to the students and see what they like to do. The application could be, for example, there are students who wanted to do cancer research, and I'm not trained as a, or I don't have an experience as a cancer research. I'm a modeler. Of course, I know how to equations are. I have some ideas about cancer, but I have not worked on the cancer. And I would not say that a student no, but that student has to read more about the cancer. I will help in the building the models based on the information that students. There's many benefits for that. I mean, one benefit is I am involved also too much because now it's a new area for me. My
Right.
curiosity is there, and I have to learn many things from a cancer field. But then that student is also passionate very much because that is originated from that student's interest, and
Right.
that could be because maybe there is someone in his or her family is affected by cancer, and that's why the person wants to do it. I mean, the student wants to do it.
Right.
So I think these are very, very, it's called as a flipped hierarchy in the mentoring and teaching world. Basically, you are shaping the interest of the students and grow. I mean, of course, the students cannot go that I want to solve the world hunger problem. You cannot
Right.
on the first
Right.
day, but at least it is kind of motivating it in the right directions with the help of the guidance that we are giving. So that is what I use very much, and I encourage it to focus on what you like to do. Don't copy someone else's trajectory. I mean, you cannot copy it. I mean, there could be many different reasons why I choose to be in that directions, for example.
Right.
But find out your passions and work with that passion and see who's your good mentors who is willing to guide you in that passion. I think that is the best way to do things with flying colors and do it for long period of time without getting exhausted from that area.
Yes. Yeah, you don't want to burn out for sure.
Exactly. Exactly. Yeah.
Yes. Okay, is there anything else that you want to talk about?
We have talked many different topics. The only thing I didn't talk is the snow outside your window is making me a little bit colder now. I'm in
Yes,
Arizona. Arizona is not as cold as what I'm seeing outside your window.
there's quite a bit of snow. It's unusual for us, for sure.
Well, it was literally, I mean, maybe not freezing, but close to freezing here in Arizona also tonight. And also right now, it is very cold.
Well, the desert gets cold for
I know.
sure.
Yeah, yeah.
Yeah. Yeah, I grew up in the Southern California desert, so
Yeah.
yeah, it gets a little cold out there. Thank you so much for joining us, Anuj, and we really look forward to learning more about your work and seeing more of it. And we will look for your articles on LinkedIn, Siam News, all the great places that you post.
Thank you very much, Erin. It's my pleasure to be with you and talking with you. I really enjoyed my collaboration with Madhav. He's an amazing researcher, and
Yes.
the outreach and I mean, I'm in industry, but he is embracing all different walks of the fields with open arms. I wish him all the best. He does many of these things in different places, modules,
Yes.
because so many people getting benefit from GPCE. Thank you once again for having me here.